Now, there has been a systematic review of acupuncture particularly suggested that this is safe and effective in the treatment modality. But they have done a comparative study, and these 4 comparative studies have shown that there is a significant reduction in pain for 4 to 8 weeks of therapy. And when it was compared with the sham acupuncture therapies. So there is a great potential to explore it further in a long term, how it relieves the pain, but whether it also manages the disease modification, what is happening behind the heel pain. In Ayurveda classics, Vata Kantaka is a description for heel pain. It is described Vata Kantaka for heel pain. And there are many various causes, as we know, but I won't go into the detail. But what I would like to highlight at this juncture, the Padabhyanga you can see at the base, the massage to the feet, Avgaha Sveda, steam, Viddha Karma. This is Viddha Karma, like acupuncture or acupressure, Agni Karma, and Jalaukacharan are some of the therapeutic modalities mentioned in classical text and are practiced based on the causality of the disease and the stage of the disease. So with this, I would like to acknowledge and give thanks to the organizers for giving me this opportunity. These are the different references which I took help of in producing this small presentation. Thank you very much.
Thank you very much, sir, for your extensive elaborate presentation. It was indeed a pleasure listening to you, and you have touched every aspect of plantar fasciitis. Just a small comment to make. Basically, heel is like a Pandora box. It has so much inside that I think if you have a facility of CDUS, which is known as color Doppler ultrasound, that is one of the very diagnostic tests in which you can, after taking the thorough history and clinical examination of your patient, you can go for CDUS. Ultrasound tells you very beautifully about whether patient has got plantar fasciitis or something else. Thank you very much.
Correct. Thank you. Thank you for that comment.
So thank you, Dr. Anjana and Dr. Ashwin Raut. And also somewhere I read about, and even Rama ma'am was talking about ginger oil in the management of plantar fasciitis. So any insight on that, Dr. Ashwini?
Gingerol and ginger oil, or particularly Gingibus officinalis, is a plant which we use every day in our house. It is a household remedy. It is called as a Vishwa Bheshaja. That means it is a medicine for entire world. And there is a high level of evidence of certain phytoconstituents of this ginger being useful as an anti-inflammatory drug.
Thank you so much, Dr. Ashwin. And now I would like to welcome Dr. Shubhda. Dr. Shubhda Jathar from Pune. Welcome, ma'am, and please introduce our next speaker.
Yeah.
Dr. Mona Shah.
Good evening, everyone. And first of all, let me thank organizers, Dr. Anju and Dr. Binal and the entire IMS team for giving me this opportunity to be a chairperson in this prestigious presidential webinar. It is indeed a privilege to share the platform with stalwarts from IMS like Dr. Rama Vaidya, Dr. Sonia Malik, and all the dignitaries that are there in the faculty. I would
please briefly introduce so that we can go to the top.
Introduce Dr. Mona Shah. Now this is a different lens, occupational therapist lens. Dr. Mona Shah is going to speak on occupational therapist point of view. She is a senior occupational therapist and clinical psychologist, a rare combination of 2 different specialties. She has 30 years of clinical experience and she heads Adult and Pediatric Development Center at MRC Kasturba Health Society, Vile Parle, Mumbai. Her goal is to identify, treat, and transform disabilities to abilities. And she has devised some workshops like back school for young adults, fall prevention for senior citizens. And she and her team is also deeply interested in research and publications. and they participate in a lot of national and international conferences. So let us hear from Dr. Mona Shah about her perspective for this heel pain. Over to you, Dr. Mona Shah.
Thank you so much for that introduction. I'll try and share my screen. Slideshow. So good evening, everyone. I hope my slides are visible. Hello?
Very
Yes,
much so, very much so, very much so. Mona, all
Okay.
the way.
So
I
first
look
of
forward
all, as you all are amazed with Dr. Rama Vaidya, we are blessed to have a continuous blessings of her at being at the same institute, and no one can be a biggest teacher than Rama ma'am. And it was a wonderful presentation by her and Raut sir. So I'll not try and go any deeper in the discussion what has gone through, but I'll just pass on briefly. As we all are already discussed, plantar fasciitis is the result of collagen degeneration of the plantar fascia at the origin, which is at the calcaneal tuberosity of the feet. What we need to understand mainly when we are talking about the therapist perspective is what is the role of plantar fascia in our body. We all know it is mainly as a shock absorber, and it is where we all discuss it's a strong fibrous attachment that runs from heel to the ball of the foot and the toes. It's like a stretchy band with what we see like as a rubber band, and it connects the bones in the foot together and form the arch of the foot. As we all know, the onset is very common, and now we are discussing purely about with the menopausal women. We have never thought of this. We frequently keep getting patients with the complaint of plantar fasciitis, but we had, after Rama ma'am gave us a talk, we started thinking about it, why it could be due to this. As we also, it's a main fundamental function is the shock absorption. What I thought of while we are talking about the shock absorption, it is best that it acts as a, I wanted to explain it with the windlass mechanism. We all know that like how windlass mechanism works, but how it works in the plantar fasciitis and in our foot mechanism. It acts as a propulsion mechanism to drive the body forward. We mostly know when runners or when we walk, while walking, how does we move? And this is what is the mechanism which it walks with. One of the easiest way to understand this function is to compare it with this mechanism. And as shown in the picture, very broadly and nicely it's shown, when the big toe is relaxed, when we know where foot is in the relaxed position, plantar fascia is also relaxed and keeps the arch from collapsing. It helps it. And when it is tightened, while toes are dorsiflex, as you can see in the second picture, where the toes, all the toes are dorsiflexes to act as it acts as a rigid lever and increase the foot stability. And this is the mechanism which always happens when we walk, and it becomes faster when the runners are running quickly or the running. So this mechanism extension and the relaxation is the most basic to understand how the plantar fascia works. Now, when we are discussing about, in brief, we have already discussed about the signs and symptoms. Just to repeat, it's the heel pain. When most of the time we get women which complains of they cannot keep their feet down on the floor in the morning, and maybe after long periods of sitting or working, it's very difficult to put the first step down. What we have observed is their dorsiflexion. What we saw is very limited, and the muscles are very tight. So limping gait and toe walking, that is what some of the symptoms because of the pain, which is very common when we observe in our clinical practice. While diagnosing, what we try and do is, first of all, as a physical examination is the most important. Where is the pain, where process to diagnose as a physiotherapist or occupational therapist when patient comes to our clinic with the detailed pain history. Ultrasonography already discussed by Rama ma'am. She has briefed on the foot function index. So what I have attached is the foot function index, which is not the diagnostic test, but is this questionnaire really helps therapists to understand how foot pain has affected your everyday life. And when after therapy, how is the scale and how is it going? It evaluates on the factors of the foot pain, difficulty of walking at different positions and different situations, and at the same time, which is how is their day-to-day work is affected. So is it for the whole day or some times of the day? And then the calculation really helps us to see the progress, how much benefit our therapy is giving them. So we already discussed and in brief about the etiology and causes is definitely when a physiotherapist point of view, when we check the range of motion is the reduced great toe extension or the extension of the range of the muscle, reduced dorsiflexion, increased plantar flexion range. So that is, you can see that range has increased. Flat foot is against that we all know as the age increases out of times the arch is diminished and it goes in the flat foot. Excessive weight bearing and walking activities, that could be one of the factor. Improper shoes, I think that is very common when we see they just don't take shoes that much importance, and while walking and exercising, especially when they take up walking as an exercise, it's very difficult that if they are not walking with the proper shoes. Sometimes there is a leg length discrepancy, and many of them don't realize that it is discrepancy of very minimum of 1 centimeter or 2 centimeter, or maybe with the prolonged back pain, there could be a pelvic tilt, and then that is how is the discrepancy. Also, it's not the real, but then the leg is not coming on the floor at the same level. And maybe due to some kind of ligament tear or previous injury to the ankle or foot, there could be a cause of heel pain or a plantar fasciitis. We are going to discuss more in detail about the management and why is the first of all, when we talk about the preventive management and we effectively talk a lot about the BMI. We all know like how if the BMI is not under the regular and any women, she is coming under the obese category because of the BMI, their high BMI and the more body mass index, the foot goes, the pressure and is much more on the foot and the arch is diminishing. So maintaining of the normal BMI is the very important preventive measure if we don't want to end up in the plantar fasciitis in future. Regular physical activity, it can be discussed in depth what kind of activities or a physical exercise helps, but the combination of aerobic and anaerobic exercises, yoga, relaxation exercises, non-weight bearing exercises sometimes to reduce the pressure on the knee and the ankle instead of constant pressure coming on with the physical activity. The ideal exercises is always, as we prescribe, is a combination of exercises. Only walking is never enough. Pilates to improve the core strength. Core muscle strength is something which really needs to be taken care for every woman, but especially menopausal women. And always using the appropriate footwear with somebody who can guide them properly with the foot pressure and the foot assessment equipment to know exactly what kind of footwear is right. It cannot be uniform. It has to be customized. When we are discussing about the management, it is a comprehensive approach, and here the role of occupational therapists, physiotherapists, and pediatrists to assess the right kind of orthotic intervention. So what is the role of occupational therapist? It is mainly due to what is the first of all, to educate them why the pain is happening, what is the reason, when is pain happening, if there is a need for any modification at the workplace or at home, long standing work, if they are standing for at kitchen for the long hours, how can they reduce pressure using a small stool, changing their foot, right foot to left foot, and weight bearing, shift of the weight bearing on the feet, some kind of ergonomic advice. At the same time, at the workstation also, if they are working and sitting long time, stretching and strengthening exercise while they are at work, some kind of lifestyle modification and regular activities which will help them to remain mobile. That is, I think, this is the biggest role occupational therapists play, and then that helps them to improve their daily life and activities of daily living. When it comes to physiotherapist, there are a lot of musculoskeletal assessment I have with my colleague. I will ask her to take it forward from here. Samiksha, can you take it? Unmute yourself and can you take it from here?
Yes, ma'am. Yes,
Yeah.
I can.
Good.
So, a musculoskeletal physiotherapist working under Dr. Mona Shah. So I'll take forward the presentation from here. So when we look at plantar fasciitis or heel pain from a physiotherapist perspective, what we go forward with is muscular assessment and diagnosis, which basically contains range of motion and strength assessment for the patient. And diagnosis in plantar fasciitis or heel pain can be achieved majorly through history taking. Then go for manual therapy. In manual therapy, it is mostly mobilizing tissue, that is the calf muscles or so, which are tight. Also mobilizing the, like ma'am said, that if there is range of motion restriction in dorsiflexion, that can be a major causative factor for heel pain. So mobilizing the ankle joint to increase dorsiflexion range of motion is what manual therapy actually consists of. The exercises is are exercises include strengthening and stretching exercises. Basically, like there are other exercises, but these are the two basic things that we focus on. Then when it comes to modalities, means the electrotherapeutic machines that we use to reduce the pain for the patient. Whenever the female is coming to us with the complaint pain, the primary goal for us is to reduce the pain. So to reduce it, modalities are used and the rate analysis is done. So depending on how the patient is walking, we analyze what is going wrong. For example, if the runner is coming to us, we analyze where he is putting his foot first. That is giving him the foot pain. So accordingly, when a menopausal woman comes to us, we'll assess the gait pattern of the patient. So as in, if the patient's foot is going in a proper phasic manner. So in management, as we saw the modalities, so what comes exactly under modalities is low-level laser therapy. As we can see in the first image, the red light that is put on the heel. So low-level laser therapy is basically cold laser where there is no heat perceived and the intensity is low, that is less than 0.5 watts, and it like increases the blood supply. It helps in regeneration of the cells around the tissue, around the area that we are applying it to, and helps in relieving the pain. Then there is something called as ultrasound, as we can see in the image too. It has a probe through which ultrasonic waves are passed inside the tissues, and through micro massage technique in the tissue, there is a healing process that is accelerated, and the pain comes down. Then there is something called as iontophoresis, where the picture is not here, but it is application of the current, frequency current along with the ions. So these ions go through our body and they bring pain relief for the patient. Then there is dry needling, as we can see in the image, which is very similar to acupuncture, what Rama ma'am was talking about. So if an acupuncture therapist is like giving the therapy, it is very similar to what we give as dry needling. Then when we talk about
request to conclude early because we have one more speaker waiting. Thank you.
Oh, yes, ma'am. So in therapeutic management, it is basically about manual therapy and mobilization, as I said. Then stretching for the tight calf muscles, taping technique, as we can see in the first image, where the tape is put to correct the position of the ankle and also to inhibit the pain. Then foot orthosis, that is the insole, which has a medial arch support or an elevation in the medial arch, because of which the foot is placed in a right position inside your foot. Then footwear modification. While looking at footwear modification, we always see that females tend to wear flat chappals and not a proper footwear when it comes to wearing a footwear in a daily life. So modifying that and also having a proper support in the footwear. Then in exercises, in intrinsic muscle, we see toe extension. It helps in increasing the arch and stretching the plantar fascia. So toe extension exercise helps in strengthening the extensor muscle. So we often look at strengthening just the intrinsic muscles, but we forget about strengthening the other muscles, the other major muscles in the lower limb, that are the quadriceps and the gluteus. So doing squats and sumo squats helps us increase the strength in these muscles and eventually have a better position of our lower limb in general, as it is a chain. So the first video shows strengthening for the calf muscles along with toe extension, which in conjunction with the windlass mechanism helps in improving the arch and lengthening the plantar fascia. The first exercise here is to improve the strength for the gluteus medius muscle, which helps in abduction of the foot, abduction of the hip. And the second exercise is to increase the strength of vastus medialis oblique, which helps us in positioning the foot in a proper way and avoid having an excessive Q angle or valgus in the knee, which would put excessive weight on the medial side of the foot. These are some stretching exercises for calf. Thank you.
Thank you, Samiksha, and thank you so much, everyone, for that patient hearing. It was a very short time for show us in detail. We tried our best to show through the videos all the exercises.
Sorry for the time, but you did a great job.
Yeah, you did an excellent job, Dr. Mona and Samiksha, and those videos, the explanatory videos were really very good, and they'll be very helpful on day-to-day basis for us as well, not only for our patients, but us as well. So thank you so much, Dr. Mona.
Thank you.
Yeah, please invite the next chairperson, Dr. Kumkum. Yeah. Can we have Dr. Kumkum from Patna, please? And please invite the next speaker. Yeah, Dr. Kumkum is a senior IMS person, president from Patna Menopause Society. Dr. Kumkum, are you there?
Yes, I am there. I am here.
Yeah, okay.
Yeah, I
So
thank
please
the
invite the next
organizers.
speaker.
Yes, I thank the organizers for having given me this wonderful position to chair this prestigious session, and also to come to face with the founder president of IMS. So thank you so much, the organizers. So now I'm going to call the next speaker. She is none other than Aastha Singla, and she is a scientist. She has done integrated PhD from Tata Institute of Fundamental Research, Mumbai, and she's a Bachelor of Science. She has many honors and awards to her, and she has got funding support from Science and Engineering Research Board from Government of India. And presently, she is PhD scholar in Professor Vadya's lab, Professor Vadya, Department of Biological Sciences, Tata Institute of Fundamental Research, Mumbai. And she's also going to, I think, present a video of exercises. So, yes. Dr. Aastha Singla, over to you. The platform is yours.
Thank you so much, Dr. Kumkum Sinha. I'll just share my slides. So, I hope the screen is visible and I'm audible.
Yes, yes.
So, good evening, everybody. And first of all, before beginning, I would like to really thank Dr. Rama Vaidya ma'am for inviting me here in this IMS Society meeting. And I'm really glad that I'm a part of this meeting and I get to present some of what we work. Right. So for today, my topic is exocrines and heel pain, and how from a basic scientist perspective, this could be looked at. So as Dr. Sinha introduced, I am an integrated master's and PhD program student at the Tata Institute of Fundamental Research in Mumbai. Our lab is called the Hutment Lab and is run under the supervision of Professor Vidita Vaidya, who is the daughter of Dr. Rama Vaidya. And in our laboratory, we study the neurobiology of emotions in response to various interventions, environmental, pharmacological, etc. And one of those interventions is physical exercise, which we model using rodents, which are rats and mice. So as we all know that physical exercise has several positive effects. It can reduce mortality overall. It can increase cardiorespiratory fitness and can reduce depression. And physical exercise can be of various different types and can affect several organ systems throughout our body. And within the molecular mechanisms that mediate the effects of physical exercise can be studied in preclinical research using rats and mice, using models such as treadmill running as shown at the top and voluntary wheel running as shown at the bottom. And the research so far has shown that physical exercise can induce positive effects on various different organs, such as adipose tissue. It can reduce overall adiposity, and can reduce blood pressure, and has several other positive effects. And on the brain, it is known to increase neurogenesis, which is the formation of new neurons. And overall, it can increase the amount of lean mass in our body, reducing the adiposity, and can overall reduce the risk of diseases such as obesity, etc. So now when we talk about the beneficial effects of physical exercise on various organs, physical exercise can induce the release of small molecules called as exocrines, which was also alluded to by Dr. Rama Vaidya in her talk. These molecules, which are called exocrines, can be released from organs such as muscles, which are called specifically myokines, and liver, hepatokines, etc. And various exocrines as such which are released from various different organ systems into the bloodstream, they have now been shown to lie upstream of and being able to induce the effects of physical exercise on various organ systems. We in our laboratory are mostly interested in, we are neurobiologists, so we are interested in looking at what the effects of physical exercise on the brain. Physical exercise is a natural antidepressant, and it can reduce anxiety-like behavior as well. It can improve memory function, and it has also been shown to be very effective in neurodegenerative diseases such as Alzheimer's disease, etc. Now, the interesting part over here is that several of these exerkines can cross the blood-brain barrier and can induce the formation of growth factors in the brain, which are basically good for overall mental health and on specific behavioral outcomes as well. So, as we discussed, that there are these various exerkines that can be released into the bloodstream. Some of them are mentioned over here. So one of these which we can easily recognize is lactate. We all know that with physical exercise, there's a molecule called lactate that gets released. And several of these now have been shown to cross the blood-brain barrier and improve cognition, mood, etc. Some of these molecules are also anti-inflammatory molecules, which can bring down inflammation overall. And owing to all these benefits of exercise and exerkines, exercise mimetics are now being researched upon. These molecules which are released with exercise, they can be used as exercise mimetics, and they are now being proposed as therapeutics for several neurodegenerative conditions and as well as metabolic conditions. So for example, over here, a molecule called irisin that can be released from the muscle upon exercise can go to the blood, cross the blood-brain barrier, and in the brain lead to the formation of this growth factor that can not only improve general learning and memory abilities, but also reduce depression-like behavior. So given all this background, then what was interesting to me per se when I was reading about plantar fasciitis was that in the cases of plantar fasciitis, as some of the previous speakers also mentioned, there are enhanced occurrences of these neuropsychiatric conditions such as depression, anxiety, etc. And then because they have this heel pain, so there is a struggle to stay physically active as well and carry out their normal day-to-day exercise, the aerobic exercises mainly that they do. And associated with this, as I said, there are higher rates of depression and anxiety disorders in the patients of plantar fasciitis. And also, in addition to this, of course, they say that since Dr. Mona also mentioned that higher body weight can predispose people to develop plantar fasciitis. But in turn, when people are at rest and not doing their regular physical activity, it can in turn lead to even more higher body weight. So the person can get stuck in a cycle, as this patient describes, that I can't seem to get off a wheel that I seem like I am on, and I'm exacerbated by it. So, given this context and the fact that these exerkines are now being used as exercise mimetics to reduce depression, anxiety, etc., and also these molecules can induce what we call as fatty acid oxidation, which means they can bring down adiposity and thus can maybe prevent the increase in the body mass index that can in turn happen because of plantar fasciitis. So thus trying to make the fact that these exerkines and exercise mimetics based on these exerkines, one of them was also mentioned by Dr. Rama Vaidya, she was mentioning in terms of sarcopenia. So if I was just wondering, and this was just a very naive thought that I thought I will share with you all, that if these exercise mimetics can be used as an adjunct to whatever therapeutics are already in use, just to manage the patients better. And I would love to hear other people's thought on that. And these are just some of the exercise mimetics that are available already in the market. Like some of them are like cumin, which is and berberine, which are really plant derived, and ginseng, etc. Some of this we were discussing earlier. So these have been shown to elicit positive effects such as improved lipid metabolism. So it could prevent the in turn increase in obesity that could happen with plantar fasciitis, and also have positive effects on the brain and body mass overall, and help manage obesity. So then I was looking at the genetic factors that could predispose a person to develop plantar fasciitis, and it turns out that there are not that many studies that show it. And I think there is still much that needs to be done on genetic variants that directly have been shown to be associated with plantar fasciitis. However, there are these variants in these genes that are known to occur in humans, and some of these variants are associated with obesity. So from that lens, if we look at it, the mutation in a gene called FTO, which is fat mass and obesity associated gene. So if this gene could predispose people to develop obesity, and in turn they could be more predisposed to having plantar fasciitis, that could be interesting. And in the light of this, in this light, I've also wanted to discuss the inter-individual variability that is known to exist with physical exercise interventions, and also supposedly with exerkines. One of the intrinsic factors that regulates it are the genetic factors. As I mentioned, some of the genetic factors, if this sort of research could also be integrated into the clinics to predict which people, based on their genetic signatures, if we could predict the predisposition of people to develop a condition such as plantar fasciitis, or if it could be prevented. So that's all. This is our lab, and this is Professor Vidita Vaidya, my PhD supervisor. I would really like to thank Dr. Rama Vaidya again, and all the organizers, including Dr. Mona Shah, and open for discussion. Thank you for your attention.
Thank you, Dr. Aastha Singla, for giving such an you dealt everything that was related to exerkines. How exercise, then exercise related to the mental, the physical, and then correlation with other hormones and adiposity. You left nothing. And the new thing that you introduced was the genes aspect, that we should go and see that is there some correlation with the genes. That is where your science comes in. So it is open. You can other people can ask questions.
Aastha, you were
Yes,
to
Dr.
talk a little bit about your findings. You found
Okay,
this.
I can do that. I thought like I was not sure.
No, I
Within
would
10
love.
minutes.
I think this is very interesting, and you must.
Okay.
With
I
your
can just
permission.
talk about it.
Yeah.
Yeah. So I can just talk about it like that. So what we have found in our laboratory is that we were looking at, as I mentioned, that physical exercise has several positive effects, several positive neurobiological effects, right? It can improve depression, anxiety, memory, etc. And this slide over here shows that the various effects of physical exercise, the various effects of physical exercise on various aspects of the hippocampus, which is one of the regions in the brain which is most susceptible to physical activity. And this brain region is responsible for several of these behaviors. So what we were studying was to look at the molecular mechanisms that mediate the effects of physical exercise on the brain. And what we found is that while we were using two mouse strains, two very closely related mice that have been inbred separately for more than 150 generations, what we found that both of them, when we subject both of them to 7 days of physical exercise, only one of them was showing positive effects of physical exercise on the brain. However, the other mouse strain was not. So if I can just switch to Rama ma'am, how much time do we have? According to that,
I think at least Minal, can she take 5 minutes, because very interesting results are there. which will translate
Okay.
in our mind that sometimes our patients are doing all their best and still they don't lose weight.
Right.
That explanation arises here.
Sure, ma'am.
Yes. So, by the way, on this study, Dr. Rama ma'am is a collaborator and she has provided us various insights into this. Right. And then, as I was saying, so we used 2 substrains of mice called as the C57 black 6 mice. The name is not important. So these mice, when so there are certain repositories in the world in which from which the scientists procured their mice. So there are 2 batches of the same mice, basically. One have been inbred in our ACTRACT Institute for about 40 years, whereas the other batch was imported recently. So what we saw was that, first of all, the mice that have been inbred, which means that brother-sister mating, sibling mating happens in the animal house to maintain these mouse colonies. So in the CRI means Cancer Research Institute, which is ACTRACT, and CRL means Charles River Laboratory. So these are the newer mice, these are the older mice. So what we observe is that after so much of inbreeding, these CRL, CRI mice showed lots of mutations. So if we go to the data, these are single nucleotide variations, and we see that in the CRI mice, we see about 470,000 single nucleotide variations versus only about 4,000, which is 100-fold. And we think that as a consequence of that, we observe these different effects. So as I was talking about brain-derived neurotrophic factor, which is a predictor of the effects on the brain, and these are serum measurements. So from the blood of the mice, we isolated the serum, and we see that in the NCRL mice, new mice subjected to exercise, we see an increase in BDNF. These are all exerkines. So we see an increase in exerkines in the CRL mice, but not in the CRI mice. Whereas both these mice are running equally. So these are the running curves. They are running equally. They are even showing similar reduction in their body weight when they are exercising. But when we look at exerkines, they do not show similar effects. And when we look at the brain, we see that if we talk about BDNF only, we see an increase in BDNF in the hippocampus of only the CRL mice, but the CRI mice do not show this effect again. And this is also translated to the amount of neurogenesis, which is the new neuron production that is taking place in the brain, that in response to exercise, there is an increase only in the CRL mice, but very small increase in the CRI mice, telling us something about the. So I'll go back to the genetics data, that this mutations in certain genes, that they could be a predictor of the responses to physical exercise that we observe. And interestingly, when we sought, this is the details are not important here. What is important is that the mutations, we found a lot of mutations in genes related to brain function, which are represented by this green cluster over here. As you can see, this is very dark, and as compared to the others. So we saw that there are several mutations related to the brain. We also saw that there were several mutations related to mitochondria, which is the powerhouse of the brain. And corresponding to this, we see that there are, so this graph is pretty self-explanatory. We see that with exercise in this new mice, CRL mice, we see a very robust increase in the function of mitochondria. Whereas in the CRL, CRI mice, we do not see this increase, which is opening up the possibilities and adding to the literature that exists about the genetic factors that could predispose an organism to the extent of the neurobiological effects of physical exercise that they will have, and even the peripheral effects. We have seen several serum measurements and etc. So this is my thesis. Thank you. Thank you.
So
Dr.
thank you
Rama.
so much.
Thank you.
So much in detail.
Yeah, thank you, Aastha. And it was really an eye-opener. And I must say that, I mean, your talk really completed the Vista vision. And so much in-depth analysis and molecular mechanics went into this Vista vision, and really impressed by the research which you people are doing. And really, I mean, that explains that why we get a varied response with the same diet, similar kind of exercise, why every organism behaves differently. So science has answers to all these things where we are speechless. So thank you, Aastha, and really kudos to your entire organization for putting in so much research. And please convey our regards to Professor Vidyata Vaid also. She was to join us, but then she is abroad, so probably her time doesn't suit. Same with Dr. Urvashi Jha, ma'am. She also was to join this session, but she could not because of her travel.
Can she produce that? You are going to play that video quickly?
Yeah.
Yes.
So please ask.
Yeah. Yes, Dr.
Please go ahead with the video of the exercise. Yes.
Yeah. So there's a small presentation kind of that I've made. So I interviewed Vidita on the basis of a questionnaire that Dr. Rama Vaidya and I found in a paper. So on basis of that questionnaire, okay, so just to introduce Professor Vidita Vaidya, she's a senior professor at the Tata Institute of Fundamental Research, where we study neurobiology of emotions. And she had so she had experienced plantar fasciitis. She was suffering from plantar fasciitis when she was about 43, 44 years old. So 10 years ago from now, it was pre-menopausal, but she developed plantar fasciitis. So her experience goes like this, that as we heard from earlier speakers, that the heels used to hurt when she used to get up in the morning, and it was very painful. So she went to see an orthopedic, and they told her that the arch was beginning to collapse. So they advised her to do something to strengthen this arc, so that when the arc comes back, and your pain will reduce. So she describes it that it was not at all pleasant, and it was like, oh my God, it really hurts whenever you put down your foot down, whenever you put your foot down first thing in the morning. So she did not go to physiotherapy, rather she started yoga, which she will describe. So she started doing yoga very religiously 3 times a week after she developed plantar fasciitis. And a lot of time during yoga is also spent on strengthening the feet, because a lot of asanas require you to hold the position with your foot. So sometimes in some asanas, there is a single foot which is planted on the ground, holding your entire body. So this everything I have quoted her verbatim. Okay, so there is not only balance but strengthening of your arc as a part of yoga exercises. So one of the other exercises that she used to do was walk on her heels forward and backward, and walk on the toes forward and backward. So steadily she used to do these exercises, not at any great speed, but to hold her balance. And she used to try to do it on a regular basis, walking on the toes and walking on the heels forward and backwards. So then, as others also pointed out, she used to do pointing of toes and flexing. And then while she was doing these exercises, she realized that over a period of time, her arc was coming back. And then eventually her plantar fasciitis pain went away in its entirety. So she says that independent of the plantar fasciitis, it went away. But after that, yoga became a far more sustainable form of exercise for her, as she went through menopause as well. She is now 54. That it helps, that she says that in general, it can help to deal with the hot flashes or the changes that you feel in your hormonal system. And it really calms you at the same time. And holding of the asanas and breathing through them, it helps in improving flexibility and strength. So there's, as others also stressed, that wearing good quality footwear became very important, and she became conscious of the footwear that she was wearing. Another important point she mentions is that she was very conscious of what she did the night before she went to sleep. She did some exercises, which one of them was shown by earlier speaker, that like marble grabbing exercises. She calls it like a pencil grabbing exercises with your toes. So even in bed before going to sleep, she used to try to grab a pencil with toes, which we will see in a video as well. So that she says that it took time, and then there are so many small and large muscles in our foot that are holding our body the whole day, which we do not pay attention to generally. And initially, the pain was a slow throb, but then it felt like a piercing pain when the heel lands. And yeah, so then she she developed plantar fasciitis, she realized the requirement to exercise the small muscles of the body, and she started doing the yoga practices more steadily. So she viewed the yoga practices as very critical, and she used to do it as often as possible. And while she says that even though the plantar fasciitis went away, she still, whenever she's sitting and she has time, she tries to do these exercises, which is circling the ankle or arcing the foot or moving the toes around. And yeah, one of the causes she says could be the gain of weight that happens during the middle age, and then but the muscles in the feet are not strengthened to the same extent. When I asked her about how it perturbed her usual routine, she said that the morning walks earlier used to be a big part of her activities, but at the time of plantar fasciitis, it stopped a little bit. But since she loves to do physical activity so much, so she was very driven to try to bring back the condition of her feet and to try to heal from the plantar fasciitis. So then yeah. So I think most of these things have been covered, but she really stresses on the impact that yoga had in managing her plantar fasciitis. So this is one of the, I think you can hear. Training your muscles and the rest in yoga. And then that's it from our side. Thank you, everybody, for listening, and thank you for this opportunity.
And please convey our regards to Dr. Vidita as well. Thank you so much, Dr. Aastha. Thank you. And thank you, Kumkum.
I'm not yet doctor. You to be doctor in the coming few months.
May I invite Dr. Sushma Bakshi ma'am from Vadodara? She's the founder secretary of a chapter of Menopause Society Vadodara, which is now a society. Dr. Sushma Bakshi ma'am.
Good evening, everybody.
Please stop the screen share. Yeah. Yes, madam.
There is no need for screen share. My duty is little difficult, but most liked one. It's urgent, and I'm happy to return the thanks to all of you involved in this wonderful webinar. I'm honored to be part of this. Thanks, Beenal, for involving me in this very important issue, and which has not been discussed in any of the webinar till date on foot and heel, which is so many people suffer out of it, but very less is known about it. What do I say about the legendary person, Professor Rama Vaidya, a mentor, a teacher par excellence, and above all, a researcher. Madam, thanks for being here and talking on the subject, which is hatke subject, I would say. Special thanks to Dynamic President Dr. Anju Soni for the presidential webinar and the presence of galaxy of stalwarts like Dr. Sonia Malik, Dr. Sunila, Dr. Meeta, and Smith Matalia really adds volume to this to the webinar. And I thank the chairpersons of session 2 on heel pain, Dr. Anjana, Dr. Sudha, Dr. Kumkum, for giving their inputs, and presence of speakers like Dr. Ashwin, Dr. Mona Shah, and Aastha at the end. She really did a wonderful job of associating the neurological points with the exercise and the relief from the heel pain. And the video was the cherry on the cake. All this could not be integrated so very well without the Sutradhar, I would say, Dr. Bhavna Ben and Dr. Reshmi. I also thank all the participants who have been here, and I'm sure all are benefited. I'm the direct beneficiary from the 2 days webinar because Pinal knows that how much I suffer from heel and foot pain. So I'm taking so many messages with me for myself today. Thank you very much to everybody. Thank you.
Thank you, ma'am. And I mean, I could not have anybody but you from Vadodara when we have so many legendary figures from IMS. So thank you so much, and gratitude again, Rama ma'am, for your vision. So you are a true pioneer for igniting this spark of knowledge. And thank you, ClearNet people, for this platform. With warm regards, everybody.
Bye. Bye.
Yeah, bye-bye, and namaskar and greetings of Navratri Ashtami.
Congratulations, Vinal and ma'am. आपको शत-शत नमन. इतना बढ़िया, excellent webinar. I could not even blink my eyes. I could not even shift my attention anywhere, and continuously with a pool of knowledge I'm carrying.
Thank you so much.
Amazing, ma'am. Amazing, ma'am.
Thank you,
Amazing.
Rama ma'am, for your presence and for your
Anju and Vinal.
Okay. Thank you, Rama ma'am.
Thanks.
Thank you. Warm regards, everybody.
Okay. Thank you, ma'am. Thank you.
Thank you, ClearNet
good
people.
night.
Thank you, Anju ma'am. Thank you, Sunita.
Good night, Rama ma'am.
All right. Thank you so much,
Didi.
everyone. Hoping to meet you again on
Thank
this
you,
platform
Meeta ma'am. Thank you.
very soon for any other next
you, Dr.
sessions. With
Meeta.
all the due permissions, we are concluding the session over here. Thank you so much. Take care.
Thank you, Ankita.
Thank you.
Thanks,
Take care.
Ankita. Thanks,
Thank you.
Ankita.
Thank you so
We'll
much.
put
ma'am.
it on the website for everybody to watch the whole recording of the
Yeah, that's
webinar.
really
It's so
essential.
important.
It's like amazing.
Yes. So we'll
Thank
put
you
the
so much,
recording on
everyone.
our website.
Many congrats to all of you. All of you.
Thank you. Thank you. So we are closing the
Bye,
session over
bye,
here.
bye.
Thank you.